Pain management represents one of the most challenging aspects of healthcare delivery, particularly for older adults who often contend with multiple health conditions simultaneously. Among the various non-pharmacological interventions available, transcutaneous electrical nerve stimulation, TENS, therapy has emerged as a valuable option for many Medicare beneficiaries. This device, which delivers low-voltage electrical currents to affected areas through electrodes placed on the skin, can provide significant relief for certain pain conditions without the side effects associated with many pain medications. However, navigating Medicare coverage for TENS units involves understanding specific criteria, limitations, and processes that determine whether the costs will be covered under your benefits. Understanding TENS therapy and its applications. Transcutaneous electrical nerve stimulation operates on the principle that electrical impulses can interfere with pain signals traveling to the brain, essentially closing the gate that allows pain messages to reach our consciousness. Additionally, these electrical impulses may stimulate the production of endorphins, the body's natural pain-relieving compounds. The therapy involves a small, battery-operated device connected to electrode pads that adhere to the skin near the painful area. Healthcare providers often recommend TENS therapy for patients seeking non-invasive, non-pharmacological pain management solutions. The approach holds particular appeal for Medicare beneficiaries who may already take multiple medications and wish to avoid additional drug interactions or side effects. The portability of TENS units allows patients to receive therapy at home, potentially reducing healthcare facility visits for pain management. The efficacy of TENS varies considerably among individuals and depends on the underlying cause of pain. Some patients report significant relief, while others experience minimal benefits. This variability underscores the importance of the trial period Medicare requires before approving a purchase, ensuring the therapy demonstrates effectiveness for each specific patient. Medicare coverage framework for TENS units. Medicare's approach to covering TENS units varies based on whether the treatment addresses acute post-surgical pain or chronic long-term pain conditions. The coverage also depends on whether the beneficiary receives treatment as an inpatient or outpatient, with different parts of Medicare providing coverage in each scenario. For inpatient care, Medicare Part A serves as the primary coverage vehicle. This hospital insurance component handles eligible expenses for patients admitted to healthcare facilities. In outpatient settings, Medicare classifies TENS units as durable medical equipment, DME, bringing them under the purview of Medicare Part B, which covers medical services and supplies deemed medically necessary to treat health conditions. Medicare Advantage plans, also known as Medicare Part C, must provide at least the same level of coverage as original Medicare, Parts A and B. However, these privately administered plans may implement different cost-sharing structures, potentially resulting in varying out-of-pocket expenses for beneficiaries. Some Advantage plans might offer more generous coverage for TENS units, making it worthwhile for beneficiaries to compare their specific plan details against original Medicare provisions. Coverage for post-surgical pain management. Following surgical procedures, patients often experience significant acute pain requiring comprehensive management strategies. When physicians incorporate TENS therapy into post-surgical pain protocols, Medicare coverage follows specific guidelines based on the treatment setting. For patients recovering in the hospital as inpatients, Medicare Part A covers eligible TENS unit rental costs as part of the overall hospitalization benefits. In 2025, beneficiaries face a deductible of $1,676 per benefit period. After satisfying this deductible requirement, Medicare covers all approved costs for the first 60 days of hospitalization, including any TENS therapy administered during this time. The coverage scenario changes for patients who undergo outpatient surgery. In these cases, Medicare Part B covers TENS unit rental for a maximum period of 30 days, beginning on the surgery date. The beneficiary must first meet the annual Part B deductible, which stands at $257 for 2025. Subsequently, Medicare assumes responsibility for 80% of the Medicare-approved amount for the TENS rental, while the beneficiary pays the remaining 20% as co-insurance. This limitation to 30 days for post-surgical pain aligns with the typical acute pain recovery trajectory, reflecting Medicare's focus on appropriate resource allocation based on medical necessity and expected duration of therapeutic benefit. Thank you for watching. If you are finding this video helpful or enjoyable, I'd really appreciate it if you could hit the like button and subscribe to the channel. It helps support our content and ensures you won't miss future videos. Thanks for being part of our community. Chronic pain coverage requirements and limitations for beneficiaries experiencing persistent pain conditions. Medicare applies more stringent criteria before approving TENS coverage. The program has established specific parameters to ensure appropriate utilization and effectiveness of the therapy for long-term pain management. To qualify for TENS coverage under Medicare for chronic pain conditions, beneficiaries must demonstrate several key factors. First, the pain must have persisted for at least 3 months, establishing it as a truly chronic condition rather than a temporary discomfort. Second, the pain cannot stem directly from another medical condition for which TENS is not considered effective, such as rheumatoid arthritis or multiple sclerosis. Third, patients must have attempted other conservative treatment approaches without achieving adequate pain relief, positioning TENS as a secondary intervention after initial strategies have proven insufficient. Medicare explicitly excludes TENS coverage for certain pain conditions, regardless of their duration or severity. These exclusions encompass chronic or acute lower back pain, which represents one of the most common pain complaints among older adults. Additionally, Medicare does not cover TENS therapy for pelvic pain, headaches, or temporomandibular joint (TMJ) pain. These exclusions reflect Medicare's assessment of scientific evidence regarding TENS efficacy for these specific conditions. These limitations highlight the importance of detailed documentation from healthcare providers regarding the precise nature, location, and cause of a beneficiary's pain. The specific diagnosis and pain etiology significantly influence whether Medicare will provide coverage for TENS therapy. The trial period process and documentation requirements for chronic pain conditions that meet the initial eligibility criteria. Medicare implements a trial period approach before committing to purchasing a TENS unit. This trial serves as a practical assessment of whether the therapy provides meaningful benefit to the specific beneficiary. During this evaluation period, which extends for at least 30 days but no more than 2 months, Medicare covers the rental costs of a TENS unit. This timeframe allows for sufficient opportunity to determine whether the therapy demonstrates consistent effectiveness for the individual's pain condition. Throughout the trial, the prescribing physician or another healthcare professional closely monitors the beneficiary's response to TENS therapy. This monitoring typically involves regular assessment of pain levels, functional improvement, medication usage, and any adverse effects. The healthcare provider must document these observations comprehensively, as this documentation becomes crucial evidence supporting the medical necessity of continued TENS use. If the trial demonstrates that TENS therapy significantly reduces pain intensity, improves function, or reduces dependence on pain medications, Medicare may approve coverage for purchasing the unit rather than continuing rentals. This transition from rental to purchase reflects Medicare's recognition that long-term use would prove more cost-effective than ongoing rental payments for beneficiaries who show clear therapeutic benefit. The documentation required for this determination typically includes standardized pain assessments, functional evaluations, and detailed clinical notes describing observable improvements. Medicare may also consider patient-reported outcomes regarding quality of life and ability to perform daily activities. This multifaceted assessment helps ensure that coverage decisions rest on objective evidence of therapeutic value rather than subjective impressions. Navigating the approval process successfully. Securing Medicare coverage for a TENS unit involves navigating several administrative steps and ensuring proper documentation throughout the process. Understanding these requirements can significantly improve the likelihood of approval. The journey begins with obtaining a prescription from a Medicare-enrolled physician who certifies that TENS therapy represents a medically necessary treatment for the beneficiary's specific condition. This prescription should clearly state the diagnosis, document the chronicity of the pain, and specify that other treatment approaches have proven inadequate. Next, beneficiaries must obtain the TENS unit from a Medicare-approved supplier who participates in the Medicare program. Working with approved suppliers ensures that the equipment meets Medicare's quality standards and that the supplier will handle the necessary paperwork for submitting claims to Medicare. Throughout the trial period, maintaining consistent communication with healthcare providers remains essential. Beneficiaries should attend all scheduled follow-up appointments and provide detailed feedback about their experience with the TENS therapy, including pain levels before and after treatment sessions, duration of relief, and any functional improvements or limitations. If Medicare approves the purchase of a TENS unit after the successful trial period, beneficiaries should clarify with their suppliers what additional supplies Medicare will cover. Typically, Medicare covers replacement batteries, lead wires, and electrode pads as necessary for the continued effective operation of the device. For beneficiaries whose initial claims face denial, Medicare provides an established appeals process. This process includes several levels of review, allowing for reconsideration of the coverage decision based on additional evidence or clarification of existing documentation. Persistence through this appeals process often leads to successful outcomes, particularly when beneficiaries can provide robust evidence of therapeutic benefit. Financial considerations and supplementary coverage. While Medicare provides substantial coverage for approved TENS therapy, beneficiaries should prepare for certain out-of-pocket expenses. Understanding these financial aspects helps avoid unexpected costs and supports informed healthcare decisions. For outpatient TENS therapy covered under Part B, beneficiaries remain responsible for 20% of the Medicare-approved amount after meeting their annual deductible. This coinsurance applies to both rental during the trial period and the eventual purchase if approved. The actual dollar amount varies based on the specific TENS model prescribed and regional pricing variations. Many beneficiaries carry supplementary insurance that may help offset these out-of-pocket costs. Medicare Supplement Insurance, Medigap, policies often cover the 20% coinsurance required under Part B, potentially reducing or eliminating the beneficiary's direct financial responsibility for the TENS unit. Some Medicare Advantage plans may offer more favorable cost-sharing arrangements for durable medical equipment than original Medicare, possibly including lower coinsurance percentages or set co-payment amounts rather than percentage-based coinsurance. Reviewing plan documents or consulting with plan representatives can clarify these details. For beneficiaries experiencing financial hardship, various assistance programs may provide support for required cost sharing. These include Medicaid, for dual-eligible beneficiaries, charitable foundation grants, and manufacturer assistance programs. Healthcare providers' offices often maintain information about available financial resources and can direct beneficiaries toward appropriate support options. Conclusion: informed advocacy for pain management needs. Navigating Medicare coverage for TENS units requires understanding specific eligibility criteria, coverage limitations, and procedural requirements. By familiarizing themselves with these aspects, beneficiaries can work effectively with their healthcare providers to determine whether TENS therapy represents an appropriate pain management option and, if so, how to secure Medicare coverage for this treatment. When considering TENS therapy, beneficiaries should maintain open communication with their healthcare team about their pain experience, treatment goals, and previous management approaches. This comprehensive information helps providers develop appropriate treatment plans and generate the documentation Medicare requires for coverage approval. For specific questions about individual coverage situations, beneficiaries should consult directly with Medicare representatives through the program's official customer service channels or seek guidance from their state health insurance assistance program, SHIP, which provides free, personalized Medicare counseling. Medicare Advantage enrollees may also contact their plan administrators for clarification about their specific coverage provisions. Through informed advocacy and collaboration with healthcare providers, Medicare beneficiaries can access appropriate pain management resources, including TENS therapy when medically indicated. This proactive approach supports better pain control, enhanced quality of life, and potentially reduced reliance on pharmacological interventions with associated risks and side effects. Thanks so much for watching. If you enjoyed this video and found it helpful, we'd really appreciate it if you could give it a thumbs up. It really helps support the channel. And if you'd like to see more content like this, don't forget to hit that subscribe button and turn on notifications so you never miss out. Your support means the world to us. Consider clicking on the videos linked in the corners if you want to watch more.